Hi friends, I am Dr. Debashish Chanda from CK Birla Hospital. I am a joint specialist, joint replacement surgeon. So today we are going to discuss about one of the very tricky problems, limb length discrepancy. Limb length discrepancy means whenever we do hip replacement surgery, there is a possibility of limb length discrepancy. That means there could be a possibility of shortening as well as lengthening. So today we have with us Mr. Abdullah. He was suffering from similar type of problem where he got a hip replacement done 2 years back, and there was a difference in length and which was causing trouble. It is well known fact that after hip replacement there is a possibility of 1 centimeter shortening or 1 centimeter lengthening of the limb, but usually 1 centimeter in traditional surgeries we say that it is well accepted. Well accepted means patient's body can adjust this 1 centimeter of length. But in this case, it was 1.5 centimeter lengthening which was causing him trouble. So let's listen from him what he wants to say regarding this procedure.
First, I would like to thank all medical support here, and then I would like to thank Dr. Debashish. I think his hand is a miracle, really, really miracle. So I don't think when I come here first time I would go back to walk again, like a normal walking. So thank you, doctor.
Thank you.
It's
a pleasure.
Thank you, doctor. It's my pleasure to meet you again. And I don't have all to say. Thank you, doctor.
Can you explain what has happened? What was the problem you were facing?
Before 2 years, I do surgery in my country, and then there is something like my whole body like going to the right side.
So it was a total hip replacement done?
Yes.
And why was total hip replacement done? It is due to
because I have anemia.
Anemia. Okay. So AVN developed in your hip and then you got a surgery done?
Yes.
Okay. So what was the problem after the surgery?
After the surgery, the same pain. Before surgery, also still pain.
Okay. So was it difficult to walk after
Yes.
the surgery? How much walking you were able to do before surgery?
Before surgery, maybe like 2 years.
Yes, in last 2 years before you met us, how much walking you were able to do?
Maybe 5 minutes.
5 minutes. And it was paining?
Yes, paining.
And your whole body was bent in one side?
Yes, in one side, right side.
So he had a difference of limb length. The left lower limb was longer by 1.5 centimeter. Usually we know that body adjusts length a lot. Okay, but in his condition it was painful and he was not able to walk. He was walking with crutches. So today is 2 weeks, day 2 weeks after the surgery. We just got his stitches removed. He is walking without a stick, so he is able to walk without stick, pain-free movement. Can you just show what you can do with your leg? Can you lift your leg up? So this is revision hip replacement done in one single sitting, and he is able to do all the activities after surgery. His limb lengths are equal now. Both the sides are equal and he is able to walk without pain. And this is within 2 weeks that he is able to do all the activities. And I just want to tell a lot of people, a lot of patients who are actually suffering from limb length discrepancies after hip replacement, and they are young, because nowadays we are getting a lot of patients with AVN or some anemia, like in his case sickle cell anemia, leading to avascular necrosis of hip, and ultimately they end up having limb length discrepancies. It is traditionally said and done that 1 centimeter of shortening and lengthening is not a problem, but if it is a problem and if it is a painful thing and you are not able to walk straight, then this can be readjusted with a revision surgery, and it is not a very big surgery. Same scars, same thing, everything. We can reduce the size of the length of the limb as well as we can lengthen the limb as well. Shortening or lengthening can be corrected. And those who are suffering from this limb length discrepancy post hip replacement, please do consider. We can definitely make some adjustment to your implant so that you can walk pain free. Thanks, Abdullah, for showing this courage from Saudi Arabia and coming from Saudi Arabia to India, having full faith in our hospital as well as our country. I think it's a privilege for us to say that people from outside are getting good treatment at CK Birla Hospital, Gurgaon. Thank you.
Doctor.
Thank you. Thank you. Thank you.
Thank you.